The
Plan Alzheimer Foundation was set up in 2008 to meet some of the aims of the French Alzheimer Plan to combat Alzheimer's disease and related pathologies as part of the Multibody Subject-Specific Institute, or ITMO, for Neurosciences, with a view to concentrating all the development and organization of research in the field in one much more efficient and flexible structure. All this research, of course, receives quite considerable funding, and it's only natural to integrate it into the Neurosciences ITMO, because Alzheimer's disease is a neurodegenerative disease and naturally belongs to this sector of activity. The Alzheimer Plan was launched on February 1st, 2008 and will run till the end of 2012. The point is to implement a number of overall measures. In practice, it covers health, social and research fields. It's the first time for 20 years that we've had a plan like this, with 15 of the 44 measures in the plan dedicated to research. The Plan Alzheimer Foundation is in charge of implementing these measures with an extremely precise and well-defined agenda. There'll be about 15 calls for research proposals with dedicated funds. The operators can be the foundation, or in some of the more important calls for proposals, the National Research Agency or the Hospital Programme for Clinical Research. The particular role of the foundation is to coordinate, organize and develop research on this disease and to increase the critical mass of the research community. We currently have excellent researchers in this field, but compared with countries like Germany or Britain, and of course the United States, in rather smaller numbers. So the idea is to intensify this fabric, this critical mass, attract new researchers and new technologies to this field, because it's a condition that causes a lot of suffering. We need new hypotheses, new approaches. Immunological fields, for example, or certain aspects of microfluidics could be interesting for studying Alzheimer's, and we'd like to attract researchers from those fields. The priorities are relatively simple. We have 15 measures to implement in a very limited time, which is quite rare in a scientific programming context, so each measure is very precisely monitored by a plan coordinator, Florence Lustmann, to make sure they're on schedule. We have now achieved just about all our targets for these 2 years, in particular opening research centres and launching calls for proposals. To give you an idea, since 2008 we've funded about 56 projects, either through the National Research Agency or directly, to the tune of more than 25 million euros for these various programmes. So we have precise aims, we know where we're going. Another advantage of this foundation is that above and beyond the plan, of course we hope to find, and we will find, a medication, that there is likely to be a lot left to do, and the idea is to keep this foundation going in the longer term. That's why we've appointed a board of directors comprising partners both from the public and private sectors. And we have a number of founders from the private sector who've contributed funds to the foundation, thanks to whom all this research work will be able to continue beyond the lifespan of the original plan.